Weight management is something that is very hard to fathom and very hard to maintain over a long period of time. The mainstay or the fundamentals of weight management, as everybody knows and has frequently been advised, is diet and lifestyle change. A low fat intake, a low carbohydrate intake, and a high fiber intake are well known to be involved in a very good diet. Exercise is the mainstay of lifestyle change, and the more exercise you do, the more muscles that you build, the more calories that will be burnt. That will increase your muscle bulk, it will decrease your fat content, and will keep your muscles burning and increase your metabolism. That is always the mainstay of all weight management systems. However, in the longer run, if this cannot be maintained, there are other options that can be chosen. If your body mass index is less than 32.5, the surgical option is excluded. The surgical options include a laparoscopic sleeve gastrectomy, laparoscopic gastric bypass, and laparoscopic gastric banding. Some of these terms might be familiar to you. Laparoscopy is also known as keyhole surgery, and this surgery involves incisions on the stomach. If your body mass index is less than 32.5 for Asians and less than 35 for Caucasians, there are other options. These other options include an endoscopically placed intragastric balloon. What does that mean? Endoscopy means a gastroscopy that goes through the mouth and looks at your stomach. If there is no issues with the stomach like ulcers or growths, we can actually place a balloon through the mouth into the stomach and inflate it. This balloon will cause the stomach to constantly feel full, and the amount of oral intake will be much less. Eventually, within 6 months to a year, another scope is done to remove the fluid from the balloon and remove the balloon in its entirety. By this time, we would have achieved two aims. The first aim is, of course, weight loss through eating less. And the second aim, which is much more important, is a behavioral change. A behavioral change means that we have to create habits of eating small amounts, eating healthy small amounts, and developing an exercise regime. After these 6 months to a year, when the intragastric balloon is removed, we continue with our good habits of eating small amounts, eating healthy small amounts, and an exercise regime, and that will maintain the weight loss over a much longer period of time. Please consult the doctor to individually tailor the weight management regimes to your benefit.